Hello everyone. Today we're back to talk about diagnostic testing for poliovirus and public health initiatives. Poliovirus can be detected in various specimens obtained from the throat, stool, and occasionally the cerebrospinal fluid. The virus is typically isolated in cell culture and detected with a polymerase chain reaction, or PCR. Cell culture is the most sensitive method to detect poliovirus. All samples should be collected as early in the course of the disease as possible. It's recommended that this is within 14 days after onset. Ranking the specimen source in terms of reliability, stool specimen is the most likely to allow isolation of the virus. Following behind are pharyngeal swabs, as well as blood and CSF specimens. Typically, it is recommended to have 2 stool samples that are taken 24 hours apart from patients with suspected poliomyelitis. A PCR test is then conducted along with partial genome sequencing to look at the genetic sequence of the virus and determine if its origin is wild type or vaccine-like. Furthermore, this helps elucidate its geographical origin. The Global Polio Laboratory Network tests all cases of acute flaccid paralysis, or AFP, among children that are under 15 years old within 48 hours of onset. AFP is caused by a range of factors, but it's closely monitored to detect stray cases of polio due to wild subtypes. And this brings us nicely into our next segment on public health measures to contain and eliminate poliovirus infections. The Global Polio Eradication Initiative is the leading organization in combating poliovirus across the world. Their mission is to completely eradicate poliovirus transmission because until it's eradicated, every country remains at risk of importation of polio. The 2 endemic countries that are the focus of eradication are Afghanistan and Pakistan. Efforts are focused on strengthening surveillance for polio and ensuring financial resources to vaccinate every last child in these countries. There are 2 different types of polio vaccines, starting with the oral polio vaccine, or OPV. This vaccine is just 2 drops on the child's tongue, and it provides good mucosal immunity, halting person-to-person transmission. Additionally, it can result in passive vaccination by spreading through excretion in areas with poor sanitation and hygiene. The inactivated polio vaccine is utilized once poliovirus has been eradicated from an area to prevent reoccurrences of poliovirus. Overall, this organization is close to ridding humanity of polio. The final frontiers, being Afghanistan and Pakistan, will be the end of poliovirus worldwide. This also goes to say that we should all be vaccinated.